Hello, I want to talk to you directly for a few minutes. Think of this as a letter from me to you. If you're someone who's living with chronic pain and you are just tired, if you're afraid to hope one more time, this is for you.
You know, there's a question that hangs in the air in so many doctors' visits. It's a heavy one, and it's this. What if this is as good as it gets?
Most of the time, people don't say it out loud, not in those exact words. But I hear it. It lives in the pauses, in the way you might look down when you're talking about how long it's been. It's in that careful way you tell your story for the 100th time. And you know what? You deserve a direct answer to that question. So let's talk about it. Really talk about it. First things first, I want you to hear me on this. I get where that question is coming from, and I need to be crystal clear about something. It does not come from a place of giving up. No, it comes from total exhaustion. It comes from being dismissed, from being told your scans look normal while you feel anything but. It comes from identity loss, that feeling that the you before the pain started is just gone. And maybe most of all, it comes from a very real thing called hope fatigue. Hope fatigue is absolutely real. It's that bone-deep weariness that sets in after you've gotten your hopes up for a new procedure, a new medication, a new specialist, only to be let down. Again. And after enough of those cycles, hope itself starts to feel, well, it feels dangerous. It feels like a risk you can't afford to take anymore. If that sounds familiar, please know that feeling is earned, it's valid, and it has to be acknowledged.
Okay, so now let's switch gears and look at what science tells us about that feeling. Because the way you're feeling, it's not just an emotional thing. It is deeply rooted in your biology.
This is probably the most important thing I can tell you. Feeling like you've hit your limit? It is not a character flaw. It is not a weakness. It is neuroscience. A brain that has been under the constant, unrelenting stress of chronic pain literally processes the idea of the future differently. So here's what's actually happening in your brain. When pain signals have been firing for months or even years, your brain's threat detector, the amygdala, goes into overdrive. It's on high alert all the time. And at the same time, the part of your brain that handles planning, optimism, and imagining a better future, the prefrontal cortex, it gets quieter. It becomes less engaged. The actual physical wiring for hope gets turned down by the constant noise of pain. And this shows us just how real that connection is. We're not just talking about being sad about your pain. This is biological. The rate of depression in people with chronic back pain is more than 4 times higher than in people without it. It's a vicious cycle. The pain and the depression feed each other. And just look at this number. It really drives the point home. One major study found that if you have severe depression, you are over 9 times more likely to end up developing chronic low back pain. That is a staggering link. It's one of the strongest predictors we have. It is a true two-way street. The pain fuels the depression, and the depression can fuel the pain. So, what does this all mean? It means something incredibly important. That feeling, that conclusion that this is as good as it gets, it might not be an accurate assessment of your reality. What it probably is a very accurate description of what a nervous system, modified by pain, can currently imagine. And those are two very, very different things.
And that realization opens up a new path. It's a path that starts not with a new procedure, but with a different kind of evaluation.
You see, in my experience, when a patient feels like they've hit a ceiling, it almost never means every single option has been tried. What it usually means is that the evaluation stopped before all the right questions were even asked.
A deeper evaluation, it goes further. It asks about the character of your pain. Is it burning, aching, stabbing? Those clues point to different sources. It looks at how your pain changes with specific movements, because that tells us so much more than a flat MRI image. It asks if the nervous system itself has become hypersensitive. It addresses the psychological side of things, not because the pain is in your head, but because treating pain in a brain that's also battling depression requires a totally different strategy. And it asks if advanced options like neuromodulation have ever even been part of the conversation.
Now, let's be really honest for a second about what better can actually mean, because false hope is just another kind of disappointment. For some people, better really does mean getting back to exactly how they were before. But for a lot of people, better means a significant drop in pain. Not zero, but low enough that it's not the first thing you think about in the morning and the last thing at night. Enough to get some sleep, enough to play with your kids.
And sometimes better is just the certainty of a clear explanation, of finally understanding why this is happening and having a real plan. Any of those things, that is meaningful relief.
And we have powerful data showing what's possible. Look at this. For people with persistent pain after back surgery, this study is a game changer. Nearly half, 48%, of those who got a spinal cord stimulator had their pain reduced by at least 50%. Now compare that to the group that just continued with standard medical care, only 9%. That is a 5-fold difference. It's huge.
And this isn't just a short-term fix. A 20-year follow-up study on spinal cord stimulation found that 69% of patients still reported a substantial improvement. Another therapy, Reactivate, had a 5-year study showing 83% of patients had clinically significant improvements. These aren't just flukes. These are the documented, long-term outcomes for people who probably once thought they were at the end of the road.
So where does all of this leave us? Where do you go from here, especially when you're carrying all that hope fatigue?
I really want this to sink in. Being afraid to hope is not the same thing as having no reason to hope. All it means is that you've been hurt by hope before. It means you need someone who's willing to earn your trust back, slowly and with honesty, not with big promises.
So I'm not asking you to feel hopeful right now. I'm not asking you to believe right this second that things are going to be different. I'm asking for something much, much simpler.
The very fact that you've listened to this, that some part of you is still searching, still curious, that matters more than you can possibly know. That's the only spark we need. So my only question for you is this. Are you willing to have one more conversation? Because that is where different answers begin.